Good evening, everyone, and welcome to this special non-CE webinar, Turn Up the Heat, NCPA's Guide to Grassroots Action, highlighting what you need to do in August as part of NCPA's Month of Action to build relationships with your legislators and the best practices for doing so. I'm Doug Hoey, CEO of the National Community Pharmacists Association, and thank you for joining us this evening. In the past few months, years of community pharmacy advocacy has culminated all at once in some big public policy wins. First, CMS issued a final rule that would bring transparency to pharmacy reimbursements in the Part D program. Thanks to your response to NCPA's calls for action, CMS even made some changes from its original proposal in the final rule, including closing the coverage gap loophole. And just a few weeks ago, the Federal Trade Commission voted unanimously to investigate PBM practices on the costs of medications. This 6B study grants the FTC subpoena power over the PBMs. Again, NCPA has been in constant contact with the FTC and asked for independent pharmacy owners to send comments, and you responded. Over 24,000 comments were sent to the FTC. And just last week, the Senate Commerce Committee advanced S 4293, which is the PBM Transparency Act of 2022. That's the PBM Transparency Act of 2022. They voted it out of committee. That's a good thing, with a bipartisan 19-9 vote. This would prohibit certain PBM behaviors and grant enforcement authorities to the FTC and state attorneys general. Now, what do all of these wins have in common? The answer is you. You answered NCPA's call and took the time to contact your legislators or submit public comments to the regulatory agencies. On each of these issues, thousands of contacts were made by community pharmacists demanding action. Thanks to the groundwork you have laid over the years and NCPA's loud voice, policymakers are understanding PBMs and acting to rein them in. Tonight's program is to help you become even more effective during NCPA's Month of Advocacy in August. But before we get into the program, I'd like to thank our sponsors, RxSafe, Pharmacist Mutual Insurance Company, and Value Drug Company for their support. And I'd like to introduce Bill Holmes, CEO of RxSafe, who helped spearhead and market this event, to make some brief remarks. Bill?
Thank you, Doug. It's my pleasure to be a part of this event. And I am the founder and CEO of RxSafe here in sunny San Diego, California. I wanted to take a moment to thank Doug and the team at NCP for all the hard work they do, and to once again state and reinforce our dedication to supporting the various activities of NCPA to, at the end, improve the lot of community pharmacy. For example, we were a key supporter of the Legal Defense Fund fundraising initiative prior to the Supreme Court's positive decision on the Arkansas case, the Leslie Rutledge case. We helped, together with others, raise over $130,000 for the initiative. I'm very proud of that. We also do a lot of active marketing to help bring awareness to the concerns and the plight, frankly, of what's going on in independent pharmacy today. And we also cherish our relationship and then provide sponsorships for the annual trade show and similar events. So I would just like to thank all the team at NCPA for the hard work they do and the amazing results we've seen and will continue to see, and pledge my support and urge others to do the same as we move forward to frankly, really restore what we used to have in the strength and the fiscal strength of independent community pharmacies. Thank you, Doug.
Thank you, Bill. We really appreciate your comments. We thank you for RxSafe support. We thank all of our sponsor support. And Bill, you mentioned teams, and it really is a team, the NCPA team, and all of our members really have helped make the progress that we're talking about in early remarks today and getting to as we talk about really building for the month of August. It's the support of people like you, RxSafe, Pharmacist Mutual Insurance Company, and Value Drug, to NCPA's LDF that truly contributes to creating a better marketplace for independent community pharmacy. Just a little bit more about the LDF. That the LDF funds NCPA's advocacy work, but there's another fund that's just as important, the NCPA Political Action Committee, or NCPA PAC, PAC. NCPA PAC allows us to support political candidates that have a history of supporting your policy positions. This webinar is supporting both the LDF and the PAC. Our sponsors are matching your individual contributions to the NCPA PAC with contributions to the LDF. Now you might ask, what's the difference between the PAC and the LDF? Well, the LDF is where companies can contribute funds. PAC contributions must be made with personal funds and aren't tax deductible. So thanks to these sponsors, your individual contributions to the PAC will be matched 3-to-1 with contributions to the LDF. So for every dollar you contribute, our sponsors will collectively contribute $3 to the LDF. And you can donate right now from your phone using the QR code on your screen. And as a reminder, PAC rules require that you must be an NCPA member to contribute to the PAC. As previously mentioned, this webinar's purpose is to help you prepare for NCPA's month of action in August, when your elected officials will be home for the congressional recess. Our next speaker is an NCPA member who is passionate about this subject. He has hosted multiple legislators in his pharmacy, regularly attends the NCPA fly-in, currently serves as the chairman of NCPA PAC, and is a past president of NCPA. It's my pleasure to introduce the owner of Middleport Family Health Center in Middleport, New York, Steve Giroux. Steve, turning the program over to you.
Well, thank you, Doug, and good evening, everyone. I am Steve Giroux, and in addition to being a pharmacy owner like many of you are, I'm also chairman of the NCPA PAC, as Doug mentioned. The motto of the NCPA PAC is get into politics or get out of pharmacy. And tonight's program is designed to help you all the more effectively get into politics and advocate for your pharmacy. As chairman of the NCPA PAC, I can't overstate its importance. NCPA PAC contributes and works to elect federal candidates that have demonstrated support for our issues. The better funded the PAC, the more candidates we can support. The candidates we support may not agree with our positions all of the time, but at least they're willing to listen to our side of the story. So I urge all the NCPA members who are listening this evening to make a contribution to the NCPA PAC. You can put it on your credit card. Even $50 or a $25 monthly contribution adds up over the course of a year and makes a big difference. And if you make your contribution tonight, as Doug said, our sponsors of tonight's program will be matching your PAC contribution with contributions to the LDF, which is another pillar of our advocacy program. The LDF pays for all the NCPA's advocacy work, staff, outside studies, the successful truth campaign, outside legal counsel. These all have costs, and the better funded that the LDF is, the more NCPA can do for you, for us. Tonight, with one investment in the PAC, you are supporting both funds. So I encourage you to maybe up your contribution tonight to specifically reach that goal. The financial piece that I've just discussed is important, but equally important is you, as a pharmacy owner, making your voice heard to your legislators. Why you? Because as a pharmacist, you are one of the most trusted professionals out there. Because as a pharmacy owner, you are an employer, a taxpayer, and a community pillar. No pun intended. Your voice carries weight with your legislators. But more importantly, if you don't tell the story of how PBMs are impacting your pharmacy and your patients, who will? The most effective way to tell your story is a face-to-face meeting with your legislator in your pharmacy. It's pretty effective in their office, but even more so on your turf. There's nothing to be nervous about in inviting your legislator to your pharmacy. Who knows pharmacy operations, the way you play, the role that you play in your community's healthcare system, the value you bring, the daily challenges you face, and the damage that PBMs are doing to your pharmacy and your patients better than you. That is the story to convey. You don't have to be an expert on policy matters. That's what the NCPA support team is for. They will prepare you with legislative one-pagers. You can print and hand to the legislator. You just need to tell your story. As an example, my most recent pharmacy visit with my congressman, I had him watch as we processed several claims, and every time we processed a profit reject, as we call them, or an underwater claim, I said, okay, Mr. Congressman, why don't you make up the difference? This one was 59 cents. This one was $2.49. Oh, this one was $25. And wow, look at this one. I lost $200 on this insulin prescription that the PBMs are paying me way under my cost. You can take that money out of your pocket, Mr. Congressman, and make me whole. How would that be? It made a lasting impression on him. Every time I see him, he talks about that and the loss that we take on those individual claims. So demonstrating some personal experience it makes a huge impact with these legislators. And there's a great opportunity upcoming to invite your congressperson to your pharmacy. And that is NCPA's month of action in August, where NCPA is looking to turn up the heat. There's a QR code on the screen, on the slide, I think we will get to in a minute, that will direct you to a short form where you can let NCPA know that you are interested in inviting your legislator to your pharmacy, and they will assist you in doing so. Try and get your schedule requests into your members of Congress by July 15th, because they do operate by deadline. So get your request in now. Thank you for joining us on this important webinar tonight, and engage the resources available to help you more effectively get into politics so you can stay in your pharmacy. Thank you very much. Thanks for being here tonight. Back to you, Doug.
Thanks, Steve. That's awesome. Very well stated. Thank you for meeting with legislators. And Steve, thank you for being the PAC chairman for so many years. It's yeoman's work and you do a fantastic job. And meeting with a legislator face-to-face is a fantastic opportunity to win hearts and minds by telling your story as you did, Steve, and showing legislators how important your business is to their constituents. Now, here to give an overview of NCPA's government affairs priorities and additional pointers on communicating with your legislators during the month of advocacy is Carrie LaViolette, NCPA's Senior Vice President of Government Affairs and the Director of the Advocacy Center. Carrie, turning it over to you. Carrie, you're on mute.
I am on mute, yeah. Thanks, Doug. And thank you, Steve, for all you do for us. It's a thankless job, and you do a really good job in helping us a lot. And Bill, I also want to thank you. You've gotten a lot involved with a lot of these advocacy sort of webinars, and thanks to all our sponsors. But really, important month of advocacy. I think we need to advance some of the slides here, and I'll get started on there we go. Okay, so thank you again for all joining us. And as we said, there's a lot of momentum happening right now. This DIR final rule was great for us. These are the things that were high level part of it. All the grassroots support really led into this. This has been years long battle to try and move the ball forward. And that's what we're doing. We're moving the ball forward. We're not at the end of the field, but this is all the grassroots support, all the congressional support. We walk into members of Congress's offices and they actually know what PBMs are now. 8 years ago, they didn't know that. And so a lot of movement in other areas as well, on FTC and other things. But this was a big win for us. We know it's not over, but it's just the start, I think, of more things to come. So this is, sort of an overview of what happened. Obviously the delay we weren't excited about, but still pharmacies should be able to know their, look at what it is. They can see what it is, and if they can accept the terms, and so it's a transparency piece of it. The lawsuit, I think, helped a lot with that, as well as what happened. in the administration finalizing this rule. But I think the lawsuit put a lot of pressure on that. Right now, the lawsuit is dropped for now, but we can all take it up again because the lawsuit would have primarily done what the final rule did. So we took a step back, and there could be future litigation. It was a chance for us to take a look at what we may be able to do in the future. There will be further rulemaking by NCPA, by CMS, on what this is going to mean for pharmacies. So right now it's kind of early to tell, and how the market may react, etc. But at least we'll know everything up front. And with the FTC study, 6B study going on, there might be some opportunities there to show what's kind of happening in this contracting stuff as these contracts are coming out now. It's kind of, that time of year where this is happening. So, as Doug referenced, we've used every avenue possible, the legal front, the congressional front, all of the above, to put pressure on someone to move the ball forward on this. So a lot of this has to do with all of you and the grassroots pressure, whether it's a member of Congress or whether it was a state legislator, whether it was putting pressure on the administration, on the White House to do something. It really, we ran ads. We've done a host of things that have tried to move the ball forward on this. And I want to thank you to all of you on this call, because I'm sure most of you either submitted comments on the proposed rule when it was open for comment, whether you contacted your member of Congress. There's been several bills introduced over the years, and it's just we're finally moving the ball forward. And I think there's a lot of momentum to be had, and we want to capitalize on that for August. We can't take our foot off the brake because the PBMs are going after us hard. Adam will get into this, Adam Harbison, who is, our lead lobbyist and on the Hill all the time on like some bills coming up, and they're fighting hard back. They can see the writing on the wall, and it's very important for all of you to try and get your member of Congress in your pharmacy. Our footprint, there's an independent pharmacy in every congressional district across the United States. The PBMs don't have that. They're in select parts of the United States, but we have a voice in every congressional district. And that's the key to keeping the ball moving forward into the next Congress, into this end of this year, with different legislative initiatives that will be happening. So I talk a little bit about FTC. This has been, a thing that NCPA has been working on for years. As many of you know, we've gotten some really great momentum there. We have a new commissioner that was sworn in who's very sympathetic to independent pharmacies, as well as the commission itself. But this is just, a snapshot of things he's said. They've had several listening sessions where they've invited NCPA members, NCPA leadership. There's just been a lot of work there. The new administration, there's new administrators, and it's a very different, the marketplace is very different than it was 5 years ago with the mergers with PBMs and the health plans and et cetera. So it's been they're taking notice because the vertical integration is really standing out to them. And this FTC, the current commission, is really interested in doing more on this. So there's a 6B study that they commissioned. And what that means is really they're going to, it's kind of wonky, but it's part of the statute where they can go after them and subpoena things that they couldn't before. So this is really, really important. And the grassroots activity on this was phenomenal. You guys really stepped up. There was thousands of comments, over 24,000 public comments were submitted to the FTC, and they've noticed. I mean, we have conversations on the side that aren't public with the FTC, and we have a dialogue going on, and we were really instrumental in what was put in, what they're going to look for, because that's the key. What are they going to ask the PBMs to submit? They've asked them for reams and reams of data, but this is going to take a little bit because the data they're asking for is great, but it's going to take a while for them to analyze it, study it. But we've, in our conversations with them, they've really pointed out that there may be points of this that, if they see something, they may be able to do something in advance of, because it's going to take probably a year or two to get through all this, but there are things they can do as an agency that if they see some bad behavior, and we've seen this in other areas where they've really taken an interest in some of these large mergers and other, not just healthcare, but other industries where they're really interested in doing that. So we kind of have the right metric there where they're really interested and, are going to go after it. So we're very hopeful there. Obviously that we know the PBMs have a lot of lawyers, a lot of attorneys, all of those things, and they're going to fight this tooth and nail. But we feel like we have the right people in place at the FTC that are really willing to make meaningful change and look at this because of the way the industry's changed in the last couple of years. So now I'm going to hand it over to Adam Harbison to actually kind of go over, what are the bills you want to talk about? How will this work? How do we get, momentum on these issues and get these meetings lined up and what you should be talking about and how all that works. And Adam has worked for us for a couple of years and is our day-to-day lobbyist on Capitol Hill. He worked on the Hill for several years in healthcare and has a really good, knowledge of all these issues and how the Hill works and what's the best way to effectively communicate with legislators when you're hosting them in your pharmacy. So I'm going to turn it over to Adam.
Thanks, Carrie. So yeah, I'm going to talk about what we're lobbying for right now. And there are three main issues that we're working on. First, providing greater PBM enforcement authority, which Doug has already touched on briefly. Secondly, prohibiting spread pricing in Medicaid managed care. And third, Medicare payment for enhanced pharmacist services. So on to the next slide. The first issue that we're talking about is S4293, the Pharmacy Benefit Manager Transparency Act. As Doug already mentioned, the Senate Commerce marked up this bill and passed it out on a bipartisan basis just last week. The bill was introduced by Senator Maria Cantwell of Washington, who's actually the chairwoman of the Commerce Committee, which had jurisdiction over this bill, as well as Chuck Grassley from Iowa. The bill specifically bans deceptive, unfair pricing schemes that PBMs do today, the biggest of which being spread pricing. The bill would also prohibit arbitrary clawbacks of payments made to pharmacies, much like DIR fees. It would hold PBMs accountable for their practices that drive up prescription prices for consumers. And by doing all this, we would really incentivize fair and more transparent PBM practices to change the model that we have today. The bill would require the PBMs to report to the FTC on the revenue made through spread pricing and their pharmacy fees. And it would ultimately give FTC as well as state attorneys general the ability to penalize and or initiate legal action. This bill is very important. We're hopeful that it could come to the Senate floor sometime in the near future to help with that process. We need to get more co-sponsors for this bill. So if you have any meetings with your senators, please ask them to co-sponsor S4293. And on the next slide, you can see that NCPA really was instrumental in working with Chair Cantwell and Senator Grassley on this legislation. In their press release, they quoted both Doug, our CEO, as well as a Washington pharmacy owner who was one of our members and president of the Washington State Pharmacy Association. So we really think this is a great piece of legislation and hope that the full Senate will take it up before the end of the year. On the next slide, I'll get into one of our two House asks for if you're meeting with your member of the House of Representatives. This is about Medicaid managed care reform, and the bill is HR 6101, the Drug Price Transparency and Medicaid Act, sponsored by Vicente Gonzalez of Texas, and of course our pharmacist Buddy Carter of Georgia. So this is a federal fix to Medicaid managed care. A lot of states have started this reform in their Medicaid programs, but this would be a federal fix across the board to prohibit spread pricing in the Medicaid managed care space. We would move this to a pass-through model instead of the model that exists today. Pharmacists would be paid based off of NADAC, the National Average Drug Acquisition Survey, as well as a commensurate dispensing fee. PBMs would then only be paid an administrative fee, so they can no longer operate their spread pricing schemes. There is some good news about this legislation. Democrats have included part of the bill, the mandatory NADAC reporting, in their Build Back Better Act, their reconciliation package that they are trying to get passed. It's possible that the Senate could move on this bill in the coming months. They have until September. And if you've been following politics closely at all, you know that Senator Joe Manchin has had concerns with the broader cost of this bill. However, drug pricing is something he still says he wants to get done, and we hope this is a piece that can be included if a deal is reached. The good thing that helps us about hopefully getting this in a package is that, unlike most of our priors that we're lobbying for, this one actually would save the government money. So the Congressional Budget Office, CBO, has estimated that this bill, this reform, would save $1 billion over 10 years. So that's helpful in trying to get this done. We will continue to lobby to get it done this year. So please ask your congressman or congresswoman to co-sponsor this legislation if you have them in your pharmacy. And then moving on to the next bill to ask your House members about deals with Medicare Part B and administering vaccines, testing, and treating. So the legislation is HR 7213, the Equitable Community Access to Pharmacist Services. It's sponsored by Ron Kind of Wisconsin, David McKinley of West Virginia, Nanette Barragon of California, and Buddy Carter of Georgia. And what this legislation would do is essentially a scaled down version of provider status, which you all are familiar with and we've been lobbying on for several years. And this bill, the way this one is structured, is it would let patients continue to access COVID-19 pandemic and pandemic-related health services from their pharmacists in their community, and would make sure that Medicare pays pharmacists for these services. So a lot of these services that are out there now have been covered under emergency authorities, and this would codify them in permanent law to make sure that pharmacists can be paid in Part B for COVID and flu vaccine administration, COVID, flu, strep, and RSV testing, and COVID, flu, and strep treatment. So this would be an important first step to move towards broader provider status, and we're hopeful that this can happen, especially to make sure that pharmacists can continue to do these services that they're performing today after the pandemic, the public health emergency ends. So next, I'll talk about some helpful tips for your pharmacy visits if you have your member of Congress or your senator in your pharmacy. When speaking about our issues, there's a couple things to keep in mind. First, really keep it simple. Steve did a good job talking about how he shows firsthand experience processing claims to show the member of Congress how things work. This is obviously going to be new to a lot of members, so keeping it simple will really help them. You also need to relate it to patients. This is going to be first and foremost of importance to a member of Congress. Yes, they want your small business to thrive, but they really want patients, especially in the Medicare and Medicaid space, to be taken care of and have the lowest possible drug prices as possible. So relating it to patients is very helpful to hit things home with your member of Congress. Also avoid industry jargon. In the pharmacy world, we have lots of acronyms, so try to avoid using those if possible to keep your member of Congress from getting confused. And lastly, share examples. Again, whatever you can do to show how you're losing money on claims. Tell stories about patients who were steered to another pharmacy or patients being forced onto more expensive brand medication because of their plan instead of a generic that a doctor prescribed for them. Next, really do your homework. We want to know that our members of Congress who have sponsored our legislation thank them. Show them that you know that they're doing what we've asked them to do and that we appreciate it. If they're not already co-sponsoring it, look at others in their delegation in your state to see if they're co-sponsoring legislation and use that as a way to encourage your member of Congress to co-sponsor a bill. You can look this up at www.congress.gov and simply search the bill number to find out if your member of Congress or someone in their delegation is currently co-sponsoring one of our 30 pieces of legislation. Next, make sure you take photos with a member of Congress. This is important. Your member of Congress is probably also going to have somebody on staff with them taking pictures because they want to promote it as well. Make sure if you take pictures, send them to NCPA so that we can share them on our social media, and be sure to tag NCPA in any of your own social media posts. Next, make sure you follow up with the member of Congress's offices with a thank you note. It still goes a long way to send a thank you note and to let them know that you appreciate them coming in to visit, and remind them once again to co-sponsor the different pieces of legislation. And finally, if you have any questions from the congressional offices that you don't know the answer to, please flag them to us at NCPA so that we can follow up with the office and get them the answer that they need, hopefully to help them get signed onto a bill more quickly. And on to the next slide, the logistics. Steve has already mentioned, but really, you need to request your meeting as soon as possible, no later than July 15th. I know it seems like August is still a bit a ways, but in the eyes of the congressional office, who has a busy schedule to keep, especially in an election year where they have to be out campaigning as well, they're already building those August schedules. So it's really important to get the requests in now so that we can make sure we try to get on the congressman's schedule in August. You need to let us know when your visits are scheduled so that we can help you get any of the materials you need. You can also let us know if you are not hearing back from Hill offices after you've submitted the request, because we can assist you in reaching out and trying to help get a meeting scheduled. And as I mentioned, we'll email you all the talking points on the 3 bills that I've gone over, as well as leave behind materials prior to your visit so that you can email them to the office as well as print them to give to the member of Congress when they're in the store. More information on this is available on our website at the link here. On that page, you'll also see a mock congressional visit that was done by Buddy Carter at Grubb's Pharmacy here in Washington, D.C., owned by Michael Kim on our board. And that's helpful as well, just to show you how easy and simple hosting your member of Congress is and what a member of Congress likes to hear and see in those visits. And lastly, if you have any problems, please contact Michael Rule on our staff with any questions and issues, and he will be the one working with you to get you these talking points. So again, contact Michael with any questions. And with that, I'll turn it back over to Doug.
Thank you, Adam. I've got to get all my screens here going. There we go. We actually have, that was a great update. I heard you loud and clear, July 15th to make those visits, schedule those visits, because like you said, the schedule will fill up. I want to thank Carrie also for your great presentation there, and for both of you to brief the group here on what are the priority issues that we want these members of Congress to hear. We've received a few questions, and so I'm going to read the question and then actually probably Carrie, Adam, call on one of you to address it. So this first one is from Don in Arkansas, and he asked, one of Congressman Westerman's top aides grew up in Sheridan, Arkansas. How do I leverage this relationship? So I'll let Adam or Carrie, either one of you filled that one.
Sure, I can jump in quickly, Doug, especially as somebody that's worked on the Hill before. I think any of these personal connections that you can make with the staffer are helpful. Finding out where they grew up, who their family is sometimes. Any of that information just helps you build a personal connection so that the staffer will remember you moving forward. And anytime a pharmacy issue comes up, obviously they know they can always contact us here in DC as lobbyists, but a lot of times they prefer to have a local voice. And so you sticking out in their mind because of some personal thing they've latched onto is great for them to have that relationship with.
Hey, Adam, how many people does an average office see in a day or a week? Just to give everyone a magnitude as far as how many faces these staffers are seeing every day.
I mean, pre-pandemic, on a normal session day, you're probably having 10 meetings a day as a Hill staffer. And those can range from obviously one-on-one meetings to big fly-ins where one of your meetings might have 20 people in it. So, it's very difficult to keep track of hundreds of faces in a week.
Yeah. So that's the story, story about a constituent and a connection to that staffer. I would guess that's all the more important to help that person stand out among the many hundreds of faces they see every day. Is that fair?
Yes, very fair.
Very good. Let's go on to the next question, which is from Andrew in Missouri, who asked, are there any tips on an itinerary if we were able to host a representative at our pharmacy? Carrie, you want to take that one?
Yeah, sure. Thanks, Doug. Yeah, we can equip you with all of that. There's on the website and Michael Rule, who will connect you with all of this. We have the most important part is to show a patient story. That's what really resonates with people is, hey, show them behind the counter, show them this, show them what you're doing in the community. And we can definitely assist with that. We have sort of a checklist we can send you, and it's seamless. We make it very easy and make it to the point because, you have limited time on these visits. The member of Congress may only have 30 minutes. So you want to make it tight and do these things, but we definitely have guides to help you that are on the landing page of the month of action.
Great. Yeah. And I'm assuming the itinerary, Carrie, that the member of Congress and his or her staff will have a pretty tight schedule that they'll want to run on that visit. So having that itinerary will be really, really a key thing to follow during the visit, I assume. Is that right?
Correct. Yes. And we can equip our members with all of that to just make it short, sweet, make it seamless because they may have limited time, and we have tools and handouts to help with that.
Great. Fantastic. Let's go on to the next question. Bill in Iowa asked, does NCPA have a congressional fly-in schedule for 2023? I'll take that one. Yes, we are planning an in-person congressional fly-in on April 26th and 27th, 2023. I think we mentioned some of the reasons why that wasn't in the cards in 2022, but we're very hopeful, very optimistic to have our regular fly-in that we've been having since 1968 on April 26th and 27th of 2023. So mark it on your calendars, tell your friends, and look forward to seeing you there. I think we have time for maybe two more questions. This one is from Diane in Pennsylvania, who asked, how can state associations support the efforts? And Adam, Carrie, I'll let you guys flip a coin as to which one of you want to answer that one.
Sure, I'll start, Doug. State associations are key, and when we had our in-person fly-in, they were very key in helping organize all the meetings, etc. So we've sent things out to the state associations on what's happening in August. So please, reach out to your state association, ask if they can help, assist, if you can get groups of members to, band together, in certain areas. That's key. So we're not like on top of each other or scheduling different things, but with state associations are key to that. And we, they're very aware of what we're doing. So hopefully, if you're hesitant and like want to group up with other folks, they can help with that.
Yeah, that coordination, Adam, I don't know if you want to comment just how important that coordination is so that, more than one entity isn't showing up or scheduling visits, unaware of the other. And so just that coordination, how important that is to an office when pharmacy groups are visiting a member of Congress.
Yeah, I would agree, Doug. And I noticed in the chat too, some people, I think Steve was talking about this. I mean, even if one person is taking the lead and inviting a member of Congress to a pharmacy, that doesn't mean other pharmacies can't be there to join with them, because a member of Congress is obviously going to be happy to meet multiple constituents in one visit. So coordinating something like that is definitely appreciated from a congressional perspective.
Great. Let's do one more. So Grace in Florida asked, as a student chapter, we are trying to get more involved in advocacy and legislation, but where is a good place to start? We love our students getting involved early. Carrie, you want to take that one?
Yeah, sure. I mean, NCPA has can help with all of that. We have a staff member who helps with all the state association work, or the student chapter work. Sorry. So yes, it's great. So coordinate through NCPA, coordinate through your state chapter, all of the above, because members of Congress really, I mean, the meetings I've had, they really like seeing students, and they're really engaged in like advancing their profession, and they really like hearing their stories of why they went to pharmacy school, what they're doing. So yes, it's a very important aspect of this campaign, and definitely reach out to your chapter or NCPA and we can connect you.
Yeah, I'm excited to see this question because starting early, as Steve very accurately said, it's get into politics or get out of pharmacy, and to start exercising that muscle early as a student is really important because it's a muscle you'll use the rest of your career. So I'm excited to see this question, and it's always excited to see student pharmacists begin early. And I just encourage any visits to really go through the talking points that Carrie and Adam went over, as to really focus your discussion as you meet with legislators.
Doug, if I might jump in on
please,
that,
Steve.
My first NCPA or then NARD legislative conference was as a student, and I don't think I've missed a fly-in since I was a student when we've had them. So it's very, very important, and you begin to build relationships, and you have to keep in mind that Congress people change over time. So it's important to refresh those contacts and those relationships over time. But I can tell you that many of the issues that we're advocating for, even this August, when the students talk about what they see their practice being like going forward, it's very, very beneficial to the discussion with the congressperson to have the students talk about that. So sorry about the dog.
Yeah, just goes to show we're live in Memorex. For those who remember Memorex, we're live and in color here. So thanks for that, Steve. And it just goes to show how, again, throughout your career, I mean, you've had a lengthy, illustrious career, and it started early. So again, really appreciate students getting involved early. This has been a great session. This is, unfortunately, it's all the time we have now. We may have some questions in the chat, and if we've missed any, we will follow up to answer those questions. And you can feel free to reach out directly to Michael Rule. So that's M Rule, like a ruler, Rule, M Rule, MRULE at ncpa.org, and he can get your questions answered. And as we close this evening, I want to again thank Steve so much for his leadership on the PAC chair, Carrie and Adam for your insights, and to our sponsors. I want to again thank them for their support, RxSafe, Pharmacists Mutual, and Value Drug. As you can tell from tonight's program, we've gained a lot of momentum, and now is not the time to take your foot off the gas. In fact, it's the opposite. Now it's time to mash the accelerator even harder. We need you to continue to meet with your legislators and inform them that while we appreciate the progress that's been made, there's a lot more left to do. It's kind of like we've made the playoffs, but we still have to win the playoffs and win the championship game. There's more to do. I can assure you that our opponents are not letting their foot off of the gas. If you've not done so, please use the QR code on the screen to fill out a short form letting us know that you're interested in hosting a legislator in your pharmacy in August. Our staff will follow up individually and provide you information on how to request a visit. But don't wait until August. Like Adam said, July 15th, July 15th, July 15th. Congressional offices are already working on their August schedules, so the sooner you can get your request in, the better. Once again, thank you to all of our sponsors, RxSafe, Pharmacists Mutual Insurance Company, and Value Drug Company for your generous support of this event and NCPA's LDF. If you haven't done so already, please consider a contribution to NCPA PAC to take advantage of that 3-to-1 matching funds from our sponsors that will support the LDF. Scan the QR code on your screen. Every contribution is matched, and every contribution helps. On behalf of your NCPA team, thank you again for your time and support. This is Doug Hoey. Have a good evening.